Hello. So we will start with head and neck muscle anatomy. The objective is to teach relevant radiological head and neck muscle anatomy to aid in target volume delineation. So we'll be discussing only those muscles that are relevant to head and neck contouring. An important disclaimer here before we start. Number one, I am not a radiologist, and number two, this presentation is not intended for radiologists. So this is going to be a very basic radiological anatomy presentation that will help you confidently and correctly contour your clinical target volumes. I'll also be sharing a few tips and tricks along the way that I've learned over the years. And any mistake, please point it out in the comment section so that others can benefit from it. I'll also leave my email ID in the description if you want to reach out to me. So this is the first lecture in this series on head and neck muscle anatomy. In this video, we are just going to quickly brush up our anatomy. We are not going into any details. We will be seeing each muscle's radiological anatomy in more detail as a separate video for each muscle. And these videos I'll be uploading over the next few weeks. So please have a pen or a pencil handy. I'll be showing some images so that you can try and test your knowledge. So this is the first muscle. Please try and identify this muscle. So yeah, this muscle is the platysma. So the platysma is a thin sheet-like muscle. It's a superficial muscle in the neck that originates from the upper chest and the shoulder and inserts into the mandible and the face. On CT scan, it appears as a thin band that is deep to the subcutaneous fat. It is an important muscle because we will see that this forms the superficial limit of our cervical lymph node regions. That means all the cervical lymph node regions that we are going to see will lie deep to this muscle. However, it is not always very easy to identify. It's not a very prominent muscle. It is a thin muscle and it tends to blend with the facial muscles. So we'll discuss this again in more detail in subsequent presentations. So this is the next muscle. Please try and identify this muscle. So this was the sternocleidomastoid. So the sternocleidomastoid is a prominent and a long neck muscle. It has two heads. It arises from the sternum and the clavicle and inserts onto the mastoid process. Radiologically, this is an easy muscle to identify on a CT scan. On axial images, you will see as a paired and thick muscle on each side of the neck. And it's very important also to identify this muscle because it is an important landmark for many cervical lymph node levels, as we will see in future presentations. Here also you can appreciate the oblique course. We will see in CT images later that in the upper part of the neck it is a more posterior structure, and in the lower part of the neck it is an anterior structure because of this oblique course. So this is the next muscle. Please try and identify this. This is a paired muscle. You can see the left and the right of this muscle. You can see some lymph nodes over here. So there is a lymph node level between the right and left of this muscle. So this is a hint. So this muscle is the anterior belly of digastric, and this nodal level is the level 1A. This again here is the anterior belly of the digastric. This is the right side and this is the left side. What muscle is this? So this is the posterior belly of digastric. Again, this is the anterior belly of digastric and this is the posterior belly of digastric. There's another muscle here. What is this muscle? So this is the mylohyoid muscle. So coming to the digastric, it has two bellies, an anterior and a posterior belly that are joined by an intermediate tendon, as you can see in the image here. On CT imaging, the anterior belly is relatively easy to identify along the inferior mandible, as we saw in the images. But the posterior belly isn't very prominent, and that is why most of us usually end up including it in the CTV. Again, we'll discuss this in more detail subsequently. So this here is the anterior belly. So this is the anterior belly and this is the posterior belly. Coming to the mylohyoid is the main muscle forming the muscular floor of the mouth. On CT scan, it appears as a thin muscle. It's not very easy to identify it separate from the tongue. This muscle basically separates the submandibular space which lies below it, or you can say superficial to it, from the sublingual space which lies deeper or above it. So please identify these two muscles. A hint is that these are masticator muscles. So number one here is the masseter muscle, and number two here is the medial pterygoid. So again, these are masticator muscles. So number one here is the temporalis muscle, and the number two and three are the masseter muscle, the superficial and the deep parts. So these are all the four masticator muscles. So number one is masseter, number two is temporalis, number three is lateral pterygoid, and number four is the medial pterygoid. So as we discussed, there are four muscles of mastication. So the temporalis is a broad fan-shaped muscle. It fills the temporal fossa, and it converges and inserts onto the mandible. On CT scan, it is usually easy to identify as it overlies the temporal bone. The masseter is a prominent muscle that lies superficially in the cheek. On CT imaging, it is very easy to identify. At the same time, it is very easy to confuse. Residents often confuse this muscle with the parotid gland. So this lies superficial, or you can say lateral to the mandible. Medial pterygoid is another masticatory muscle. Unlike the masseter, this lies medial to the mandible. The lateral pterygoid is a relatively smaller muscle. So coming to the vertebral muscles, please try and identify these two muscles. So number one here is the levator scapulae, and number two is trapezius. So the vertebral muscles, they can be considered in three groups: the anterior, lateral, and posterior. So as the name suggests, very broadly speaking, these muscles lie anterior, lateral, or posterior to the cervical vertebrae. So the anterior group includes the longus colli, the longus capitis, the recti capitis anterior, and the recti capitis lateralis. And the lateral group contains the scalene muscles, the scalenus anterior, medius, posterior, and minimi. The anterior and the lateral vertebral muscles, they are together known as the prevertebral muscles. The posterior group muscle group is a little tricky. It is basically composed of the cervical components of the muscles of the back. So you have both intrinsic and extrinsic muscles of the back. The cervical components form the vertebral muscles in the neck. So to simplify, these are the back muscles. The deeper muscles are the true intrinsic back muscles, and superficial to these are the extrinsic immigrant muscles. So the intrinsic muscles are basically arranged in superficial and deep layers. We'll not go into the details. The only muscle that we are interested in is the splenius capitis, which lies in the superficial layer. And the coming to the extrinsic muscles, the muscles that are of interest to us here are the trapezius and the levator scapulae. So we'll quickly brush through these. The longus capitis is an anterior prevertebral muscle. You will see it from the base of the skull up to the C6 vertebral level, and it lies just anterior to the vertebral body. The longus colli is again an anterior prevertebral muscle. Radiologically, again, it lies anterior to the vertebral body, and it is medial to the longus capitis. Coming to the scalene muscles, you have the anterior, the middle, and the posterior scalene. These are the lateral prevertebral muscles. So this is the splenius capitis, which is a posterior muscle. Then you have the levator scapulae. This is important again, the splenius capitis and the levator scapulae, because these muscles, as we will see, form the medial limit of many of our neck nodal levels. And this here is the trapezius muscle. So this is the last muscle group. Please try and identify this. So these are the infrahyoid muscles or the strap muscles. So basically, the strap muscles on CT scan, they appear as a thin, elongated muscle. They lie anteriorly, that is in front of the larynx and the thyroid gland. It is really differentiate to separate all these muscles from each other. There are a total of four strap muscles, but we can definitely identify them as a group. So the four muscles are the thyrohyoid, the sternohyoid, and the omohyoid. So this is another diagram representing the suprahyoid and the infrahyoid strap muscles. So this was a brief introduction. We'll now be taking up each muscle one by one and seeing their CT anatomy in more detail. Thank you.